Hello, I'm Dr. Christopher Jones. I'm an Indianapolis plastic surgeon. I've been a Hoosier for 37 years. I've been a plastic surgeon here in Indy for 29 years. I'm from Dallas, Texas originally, did my medical school there, but I came up here to Indiana University. I liked it the best of the 18 places I visited, and I did my general and plastic surgery training here at IU. And I went off to Sloan Kettering Cancer Center for a year in microsurgery and cancer reconstruction training. After that, I've been in practice for quite a few decades. Then 4 years ago, I moved downtown. Just a change in my life. I noticed there weren't any plastic surgeons down here, and I decided I'm going to be the downtown plastic surgeon. A year and a half ago, I decided to open my practice here, but I needed some help, and I'm going to introduce you to my help. The first person I needed to help me was another person who I knew would be empathetic towards patients and understand their clinical plight, be able to communicate with them effectively, but also I needed a business person in that same person. I found Brittney.
Hi, my name is Brittney Conklin. I am the practice director here at Christopher Jones, MD. I've been in business management for about 10 years now and working with Dr. Jones since 2015. My goal here at the practice is to have all of the staff feel like family, because if we feel like family and we're all taking care of each other, we're having fun while we're at work, and it doesn't feel like work. And when we're doing that, we're taking better care of our patients. I also try to look at every patient like they're my dad that's getting operated on, or my mother, or brother, or sister. I think that the patients can tell whenever we care about them and we give them that kind of care. I try to put myself in their shoes and give them the kind of care that I would want for myself.
Next, Brittney and I needed some help up front. We were busy back in the office with patients. We needed someone who could take a patient in from the front door and guide them through their journey with us. Most offices would call that a receptionist or even a secretary. We decided to call it a concierge, someone who could be much more to the patients than a receptionist or a scheduler. It would be a person who would guide the patient through the whole process, to really get to know that patient, a lot of things about that patient, be able to interact with them on a lot of levels. They'd be able to get them a hotel room if they were from out of town. They could arrange transportation, parking. They could really be for that patient, whomever that patient needed them to be. And we found Becky.
Hi there, I'm Becky Lee. I started about a year and a half ago with Dr. Jones. I was really interested in plastic surgery. I have a background with makeup and cosmetics. I was looking for a position to grow with my makeup and lash extensions that I've already been doing. And I asked Dr. Jones about branching out into microblading. So I started doing that about a year ago. Dr. Jones is so amazing. He's so good with his patients. One of my favorite things with Dr. Jones is he works with bariatrics, and about losing weight has been a big thing of mine as a lifestyle journey. So I really bonded with Dr. Jones on that, and I love how he interacts with his patients. So he's really good with us. He lets us have fun, and we know how to work and get to work here. So I really love it down here at this office.
The next person we needed, we figured, was an esthetician. Believe it or not, estheticians know a lot of what plastic surgeons don't. We found that there would be a lot of overlap in our expertise, but I had noticed over the years that patients really appreciate getting other opinions besides mine, to have someone else in the room with me while we're analyzing that person's skin or discussing their wants or needs. I wanted an esthetician who was willing to learn more involved clinical practices and protocols which could even combine what I knew with what they knew, maybe to provide a level of care that really hasn't been tried anywhere else. The esthetician I found was Taylor.
So I was so excited when I found the opportunity to work for Dr. Jones, because I've been doing medical aesthetics for 14 or 15 years now. And I was at the point in my career where I really wanted to start learning new things that I could offer my patients that were not only new, but also very effective. And I could get that vibe when I walked in and spoke to Dr. Jones, that he was here to teach me and train me to be a better esthetician than I already knew how to be. So I was just so excited for the opportunity to work here.
All right, so we've got everybody, right? But then we started having a problem. We became successful. We got more patients, we got busier, and we realized we need someone who is very versatile and very enthusiastic, willing not only to pick up any kind of slack that the rest of us might have provided inadvertently with our patients, but also someone who had the enthusiasm to adopt and learn new procedures and practices. That seemed like a tall order, and we didn't think it was possible. Frankly, also, we were worried about upsetting the camaraderie and the team spirit that we had carefully built already. We were a bit fearful about that, and then Crystal dropped into us.
I'm Crystal. I'm the aesthetic consultant. When I first started here, I was nervous. I had made a career change, but what I loved about this place was that Dr. Jones and Brittney and everybody in the office is so willing to hear ideas and run with them, and that's something that I've never really experienced anywhere else. And something that really has drawn me closer and closer to this group is that we are so accepting of everybody, and we're really just willing to kind of make everybody feel comfortable, and that's something that you don't really get many other places.
Well, there you have us, the team. Our team can be your team. Please come to see us for a wonderful experience where we make you the boss.